New at 6 tonight, we are learning more about the way homelessness impacts health. There is a new report that shows unhoused people have a shorter life expectancy compared to those not experiencing housing insecurity. And Dr. Samir Vora, director of the Illinois Department of Public Health, is joining us live to discuss. Doctor, we're really grateful to have you checking in with us. Let's start with the way you defined people who are unhoused. It includes people who are living on the street, in shelters, in abandoned buildings, in vehicles, not people who are temporarily staying with friends or family here. Let's start with when you did the study and how it was conducted.
Well, we were very excited to announce the Illinois Homeless Morbidity and Mortality Report. And it takes information from hospital records and death certificates from 2017 to 2022. A report in partnership with Illinois' Office to Prevent and End Homelessness and the University of Illinois at Chicago to give us more information and more specific information on the connection between health and people who experience homelessness. And what we found were a lot of troubling statistics.
Okay, so this is the only time I understand it that a state has undertaken an endeavor like this. What were some of the big takeaways, and what were you trying to learn?
Yeah, we were proud to join Minnesota as the second state to create a report like this. And what we found was that people who experience homelessness, their time of death is nearly 20 years younger than people who do not experience homelessness. 10 times more likely to die from a overdose, 38 times more likely to die from the cold, and even 3 times more likely to be murdered. And we know that those statistics are just a few of the many that really cause and affect the health of people who experience homelessness.
Well, it is sad. It is troubling. What does this say, or what did it tell you about the strategies that the state currently undertakes, and lots of nonprofit groups that are out there virtually night after night?
Well, we know that health affects homelessness, and homelessness affects health. And that's why we've seen a big commitment by Governor Pritzker to really put action and put funding in order to make a difference. Because we know that in order to solve homelessness, we have to increase access, but we also need the wraparound services that can be meaningful to help and address this larger problem. As we know, in fall of 2021, Illinois created a new interagency task force. We have our first chief homelessness officer, Christine Haley. And in the FY 2024 budget, over $200 million a year in sustainable general revenue funding to attack this issue. Even more, $290 million will be invested in FY 2025. So we know that we have a large problem, but we know that we're putting in the beginning steps, and this being a down payment to more sustained action so that we can improve not just the health outcomes, but the overall life of people who are experiencing homelessness now, so that they won't experience homelessness in the future.
So it's got to be gratifying to see, the resources that are being committed to this. Before we let you go, can you just talk about some of the specific initiatives that people can seek if they are facing the threat or the beginning stages of being unhoused?
Yeah, and a couple, as you will see already in the budget, we're putting efforts around emergency rental assistance, safe and dignified emergency shelters, and then really working on a number of programs, including the pilot programs around Illinois stability investment for family housing, reentry pilot programs of flexible housing as well. And so we would really ask individuals to make sure that they're working with government partners, Department on Human Services, as well as their local partners to get the help they need if they or their family members are experiencing homelessness currently.
Dr. Samir Vora with IDPH, thanks for sharing the results of that study with us. We appreciate it.
Yeah, thanks so much again for having me.
Okay.